logging in, but it's 12 o'clock, so I'm going to go ahead and get us started. You're going to see we still have lots of folks still logging in, so you are absolutely welcome to keep your eye on the chat. But I am delighted that you decided to spend an hour in the first September day with me. So welcome to our first Talks on Tuesday webinar. This is our first webinar of our new season. Our new season always kicks off in September. And we really wanted to spend this hour checking in with you to find out how you're doing with providing tele-intervention with this big shift that early interventionists across our field were sort of plunked into about 6 months ago. So we wanted to just check in and see how it's going with you. So my name's Dana Childress. I'm one of our early intervention professional development consultants. I work out of my office in Chesapeake, so I've been working out of my office beyond the pandemic, but it's still kind of weird and kind of different when everybody else is too. So when we were having folks type into chat what's unique about their view, it looks like lots of you guys are in your home office, your home class, what's doubling as a classroom now. Kind of just, we've all sort of settled into this strange new normal. So today what we're going to do is really this webinar is about you, and it's not a typical webinar. It's a web discussion that's really designed to give you the opportunity to share what you know. I mean, I could have created a webinar or tried to about tele-intervention, but we already have those posted on the Virginia Early Intervention Professional Development site. So instead, what I wanted to do is tap into the expertise that you all are developing around tele-intervention and give you the opportunity to share and support one another. So that's the big idea for checking in with how you're doing. So this is a real opportunity to check in with yourself, to check in with your colleagues around the state, and to support each other and share what you know. I wanted to mention that Jeannie Schroeder is our technology specialist. She's on with us today. So Jeannie is doing all the fantastic background work to make sure this web discussion goes off. So thank you, Jeannie. Kyla Patterson is also here in case there are any questions of like sort of procedural or policy questions that pop up. We're not actually going to go over policy and procedure, but Kyla is the best resource for that. I mean, she's the go-to person who I would ask, so I'm so grateful she's here today. You will see Jeannie put a message in chat. We ask you to please keep your video off today so we don't stress out the bandwidth. If your video pops on, just turn it off and we'll certainly help. We can help with that on our end too. So before we dive in, I wanted to address terminology. So tele-intervention. So you see that this phrase is included on our title. The word tele-intervention was also included in the article that we provided a link to for you in your login email. That article was provided to us as a resource to share with you, and it's being shared across the field from the Division for Early Childhood of the Council for Exceptional Children. That's for short, we call it DEC. So DEC publishes a journal called Young Exceptional Children. In that journal, this article called Inside the Virtual Visit, Using Tele-Intervention to Support Families in Early Intervention is a brand new article, and they have released it widely for DEC members and non-members. So take advantage of it. If you haven't already, print it off or watch it, to take a swing through it through your device. And Jeannie just put the link in chat. Thank you, Jeannie. So this is a really good free resource that's chock full of good strategies. I love that they have a pre-visit checklist that you can use, and they've divided up strategies by that sort of technology considerations, building relationships, providing caregiver coaching, which we're going to talk about today, and supporting caregiver and provider reflection. How do you reflect together? So it's an awesome resource. So I want to encourage you to use your chat today as your voice. That's the main thing we're going to use, and feel free to add to the conversation as we get going. So here's where we're headed. So I loved this image because this was the image of early intervention to me over the last 6 months. You never really stopped. You kept going forward because you had to, right? Early intervention did this major shift in our state in around March or so to shift from in-person visits to visits virtually. And I'm so proud of our field. I'm proud of early interventionists in Virginia because you rose to the occasion to make that shift. So today we're going to acknowledge the reality of where we are and where we've been the last 6 months. We're going to process what tele-intervention has allowed you to do, because I've heard a lot about that from practitioners. We're also going to touch base on when it's hard, because I had a colleague the other day say to me, who's so good at coaching and everything, it's just right, she's such a great interventionist, but she said, sometimes this is just hard. So we're going to talk about that. And throughout all of that discussion, I want to invite you to use your chat to share the strategies you're using, tell your stories, and support one another. And throughout all of that, we're going to celebrate how you're growing as an interventionist, maybe whether you wanted to or not, but you are growing. And I think someday when we get to the end of all this and we get back to some kind of a new normal, there's going to be things you've learned during this time that you're going to carry forward. So we're going to talk about that too. All right, so here we go. So I am going to shift the slide to a picture. And when you see this picture, I want you to really look around it. And I want you to type into chat, what is this picture? How does this picture speak to you about our current situation? Maybe within the context of the pandemic and even within the context of our field. So take a look and type into chat what comes up for you with the current situation and this picture. How does this picture maybe reflect some of that? If you need help finding chat, you're going to hover your cursor at the bottom of your slide. You'll see a black bar appear, click the chat bubble, and then the chat window will pop up and you can enter your message in the bottom of the chat window. Hey, Jen from Norfolk says topsy-turvy. Pam says a new way to see things. That's a great positive way to look at that. Patty says the world has upended. Corey says my whole world feels like it's upside down. Yep. Diana says outside looking in. I love that, Carrie. Cha-cha changes. Yeah, have you kind of had enough of those yet? I'm feeling like that myself. Hey, Casey said a small limited glimpse of a way bigger picture. I hadn't even thought of that. That's very cool. Yeah, world may, Charlotte says, may feel upside down because of COVID, but our perspective matters. I absolutely believe that. We're only seeing a smaller piece of the family's world. Yep, Caitlin. Absolutely. Hey, Kim says, world turned upside down. We're looking maybe through a different lens. Tanelius is trying to get things back to normal. Wouldn't that be nice, right? When you try to look at everything, it's overwhelming and out of focus. Katie, I have felt that way, especially at the beginning of this pandemic. That's really powerful way to say that. Yeah, Jen says clarity. So when this picture popped up for me, you guys are really right on it where I was thinking too. Kara says overwhelming and unclear. I certainly felt that way at the beginning, Kara, for sure. So when I looked at this picture, I thought, I am kind of living in that upside down world, right? That topsy-turvy world we see in the background, because with the pandemic, everything has been flipped. How our children attend school or whether they attend it, virtually or not, how we do our jobs, how we grocery shop, how we even leave our home with masks and everything. So much has changed, and it's almost, as Kara said, overwhelming. It's unclear when this is going to end. But then we have that sphere, and you can look at that sphere. And when I thought of this picture, I thought that sphere was like my memory of I remember when the world kind of looked like that, when it looked more normal and it felt more normal, and it was kind of flipped right side back up. And to be honest with you, especially as we've moved through the pandemic in the early days of the change, everything changing, I sort of clung to that normal, I want that back, right? I want to get back to where we can do in-person visits, and I want to get back to where I'm not washing my groceries anymore, all the crazy stuff we're having to do. But I read something recently that said, the more we cling to what's in that little sphere, the more we cling to the old way, the previous way of doing things, the harder it can be to move on and to change our perspective, like somebody said in the chat. The harder it can be to sort of be present in the moment and take the moment for what it is, which is a hard thing to do. So I want to encourage you guys, because we have had to adjust to it so much, to take the next 40 minutes or so to sort of settle in, be present. We are going to think about the past. We're going to think about what happened after the world flipped, right? We're going to think about the last 6 months of tele-intervention. We're going to think about how you are right now, and then we're going to think about the future, because I don't know if we'll ever get to that pretty exact world we had before, but some things about it needed to change, and maybe there's some opportunities that we're experiencing now that are going to help and that are going to be for the better. So that's kind of what we're going to talk about today. So with that, I want to ask you the big question that was in our title. How are you? So this is where I want to start with how you are. And I think this is the question to start with families every time you have one of your tele-intervention visits, checking in with them, not only, just sort of the overall, the breezing over, how's it going? Oh, it's fine, but the digging in about how you are. So you can think about this as a big picture. How are you feeling today? You can think about this narrowing the lens, that sphere a little bit, and think about how are you doing at work right now? So type into the chat a phrase or a word or use an emoji that kind of talks about how are you doing in the context of the flipped world we're living in right now. How are you doing personally? How are you doing professionally? Tell me in chat, and this is an okay place to think beyond the I'm fine. Caitlin says surviving. That has a lot of different meanings right now, doesn't it, Caitlin? But that's what a lot of us are in survival mode. A lot of families are in survival mode, especially as the new school year begins, right? So much going on. Carrie says, higher, further, faster, living the dream. I love it. Carrie, that's what my son said when I was worried about him being home alone and not being around his friends. He's an introvert, and he's like, Mom, I'm living the dream. I love being in my room. I thought, okay, good. So Patty said, I like to ask, how are you doing today or right now? As I feel emotions and feelings lie so rapidly. That's a great question. That's a great way to add on that, Patty. Diana says, tired. Yeah, I'm weary, Diana, too, from all of this sometimes. Joanna says kind of settling into the new normal, which is great. I mean, kind of we do eventually get past a place somewhat of struggle and start to settle in. Stephanie says she's frustrated because she loves being with her family. So Stephanie, it sounds like you're missing that. Mary Kay says taking it one day at a time, sometimes 1 hour at a time, and that is absolutely okay. Jennifer says she feels like Groundhog Day, living that same day over and over, right? Andrea's overwhelmed at times. Cenelia says, still figuring things out. And that is so okay. Figuring it out, the fact that you continuing to try is what's so important. Jen says she's joyful, glad to be here, thankful for remaining healthy. Yeah, I feel like gratitude has played into our lives in a way that sometimes we didn't always stop to think about before. So that's such a rich practice. Vicky's become flexible, becoming adaptive. Morgan is accepting this new normal. Jerry says just trying to keep her head above water. Yep, Jerry, you are not alone there. Trying to do our best with so much uncertainty, being flexible, maybe open to change now more than ever. Yeah, Millie says I'm overwhelmed, but hopeful. That's great, Millie. You're on the other end of that, overwhelmed with some hope. Roberta's settled in. Mary Lou says good. Trying to find my groove. Carrie says I'm an introvert, so she gets it. Yep, you get it. What my son was saying, Carrie, with that living the dream. Rhonda's fatigued. Corey, that's your new name, Corey. Quarantined. Yeah, it's exhausting to be quarantined. Patty says quarantired. Oh, quarantired. You both said that. Janet says tired and getting by. Yeah, initially no sense of time. Robin, that's so true. I think some of us now have settled into new normals and new rituals, and we're going to talk about that a little later, but sometimes your scenery doesn't change the way it did before, so it's hard to be in the midst of that. Yeah, Mary Kay says, great. EI has rocked this pandemic. We got this. Mary Kay, I love it. That's the attitude we're going for today. Tamala says, adjusted. Ashley's adapting. Roller coaster. Talisha says, sigh. Oh my gosh, Talisha, that has been where I've been many, many days. Overwhelmed, still trying to figure out that time management with work and homeschool. Donna, we're going to talk a little about that today. Angie's given us a positive, enjoying not having to do that 30-minute commute in the casual dress. Yep, you can dress in that t-shirt and you can wear your shorts below because nobody's going to see you from the waist up, except from the waist up, right? And Katie says, cycle through periods of grief over lost events and changed plans, but thankful for flexibility. So Katie, that's a great reframing. I think grief, we felt a lot of grief, and that's so normal with this kind of change. Grief over lost events, grief over the changes in your job, grief over the normal you had before, or maybe some anger over the forced change you've had to experience. But I love that you're looking at it through a positive lens. Anna says a new level of efficiency, and Charlotte says taking it day by day. So I hope you guys were patient with me as I went through, but I wanted to acknowledge what everybody's place is in that list, because you guys hopefully saw themes. You're not alone with your being hopeful for the future, but tired some days, feeling tired, but maybe noticing that some good things are coming out of it too, like that new level of efficiency. Wherever you are, one of the best things you can do is stop to take a deep breath. So I invite you to do that to help you get present, get reset, especially when things are hard. Take that big deep breath, because sometimes paying attention to your breath, that's a meditation and a mindfulness technique. It can really help you calm your nervous system, settle any anxiety, and just give yourself that permission to check in with yourself. Ask yourself, how are you too? So empty out all the breath in your lungs. Take a big, slow, deep breath, fill your lungs up, and just let it out. You're here, you're in a good place, you've made good progress, you've learned things, and that's where we're going next to settle in and hear what you've learned and how we can support each other. So here we go. So type into chat for me, what's one big thing you've learned? Maybe it's not big, maybe it's very tiny, but it's important to you. Something you've learned by providing tele-intervention and supporting families virtually. If you're in a leadership position and you didn't actually see families, what's something you learned by working virtually to support your team, your staff? So type it into chat for me. What's something you've learned over the last 6 months from your experience of providing tele-intervention? Because sometimes when you're feeling overwhelmed or you're feeling stressed, it's hard to reflect on that, but this is your time to really spend that time to celebrate and get in touch with what you've learned. Pam says, less is more. Andrew says, meeting families where they are currently, that's so important, and where they are currently changes almost even more than maybe it did before. Diana is like a plant in the audience, forced to step up our coaching game. We're going there soon, Diana. And Jerry says, caregivers have actually been more focused and she's gotten some good results. Well, Jerry, I hope you will share those examples as we're moving through today. Kim says, more pause time to communicate virtually, maybe become a better listener. Jennifer says, Jen says, having to really talk about the last visit, what worked and what didn't work, so really intentional checking in. Good for you, Janet says, she's actually used the computer in ways she never thought she'd be able to do. Good for you, building your own capacity, right? Casey says, the importance of really being able to describe this stuff. What's it look like? What's the skills look like? How it helps kids engage in families' routines. Since you can't see it now, you need families to describe it. And yeah, we're going to talk about that need for descriptive language. Carrie feels like coaching is working well. And Carrie, what I'm hearing people say is you kind of have to coach in this format, right? Yeah, Lisa says coaching more. Mary Kay says, telling families not to walk around the house with the phone, but some folks, Mary Kay, are saying, take me with you. But I totally get it. It's hard. It's kind of hard to be on the other end watching that movement. I'm there with you. Learn to be more present, giving families more reassurance, sharing her experience, getting appreciation from parents. Families have become more comfortable. Joanne says she agrees about that more pause time. Jennifer says, this is maybe a tele-intervention is a pretty great option, can be pretty effective. We're going to focus on what the parents say, read their body language, do that really good observation. And Ashley says, people are more adaptable than they even think. That's a great one. I think this whole pandemic, Ashley is teaching us that. We are resilient and adaptable in ways, and families are too, that maybe we didn't even think so. Jen says, I got to go to Walmart today. That's an awesome thing, right? Oh, wow, she went to Walmart. Carrie went to a safari park on a visit. That's cool. Jen, I would love to hear about your Walmart visit. Enjoyed being able to at least see families, especially when you can't be with them. Yeah. And everyone's more empathetic on the tech issues. Yep, it's no longer super awful, scary thing if your kid walks in during a meeting or your dog barks. Here, you might hear my dog before the end of the visit. Everybody is more understanding now. Yeah. So I want to encourage you to keep thinking, keep this mindset as we move forward, because I want to know more about those good visits, the visit at Walmart or the visit at the safari park, or how you're seeing some cool things. That's what we're going to share next. One of the biggest things I've heard people say, oh, Jen says her Walmart visit, the mom was great about labeling stuff. Very cool. One of the cool things that some folks have really, I think whether you knew this before or not, you've had to sink into this next thought. You are not trying to engage an infant or toddler on video for 45 to 60 minutes during your virtual visit. And really, best practice in EI says we weren't really supposed to be doing that before, right? We were supposed to be focusing our energy on the parent. Now you absolutely have to. That parent is your intervention partner. Because if you look at the picture on screen, you can physically not feed that baby through the screen, right? But when you use that descriptive language and you use your observation skills, you can support her mom in knowing where to place that little tiny baby spoon on that child's tongue to avoid the gag reflex, or whatever that FSP goal is. You have the skills to support that, and you have to figure out how to share those skills, sometimes in an even more intentional way, without being able to model, which modeling is what we often rely on so heavily in early intervention. Really, this is coaching, right? You did this before. We weren't trying to entertain toddlers for 45 minutes before. We were coaching parents, but as you guys have said in chat, now you really, really have to. So one of the lovely things is popping up in chat, and I've heard people say, is tele-intervention has allowed me to do things that maybe I didn't do before. I hope you've had visits like this where you got off on the visit, or maybe during the visit you were excited because something was going well. How would you complete this phrase when you reflect on your visits over the last couple of months? Tele-intervention allows me to what? Type it into chat for me. How would you complete that phrase? And it's okay if you need a few seconds to think, because this is where we're getting a little deeper into reflection. Carrie says, be more flexible in scheduling. Yeah, Carrie, I'm hearing that about folks, especially now that you don't have that commute or people aren't traveling all over the area. Some of that flexibility has popped up. Try different routines. Jen says, type up her notes as she's in the visit. A little multitasking there. Yeah. Kara says, empower parents. And Jenny is like a plant in the audience too. Flex those coaching muscles. That's where we're going to go next, Jenny. Be more flexible with working parents. More creative in how we connect. More flexible, better observers. Katie, we're going there too in just a second. You know, that's so interesting, Katie, without a stranger in the home. I wonder if you guys are seeing some more authentic interactions because your presence is not interrupting them or changing them in the way they were when you were the stranger in the home. So there's something so valuable about that. Amanda says she's coaching more, not just demonstrating. Yeah, that sort of reliance on the modeling and demonstrating, which is not a bad thing, but now you're coaching more. Yeah, Joanne agrees with some of those previous comments, really focusing and asking caregivers what they're doing. Yeah, what they tweaked. Referring to notes from previous sessions, bonding with families more intentionally engaging parents, having a better sense of where parents are emotionally and being adaptable and flexible. Yep, Roberta, adjusting to connectivity issues because it's the name of the game. It just happens, and we're going to talk about that. So I'm going to click through and show you 4 things that I've heard specifically from early interventionists, how they've completed these phrases, and we're going to talk through them a little bit more. So this next one has popped up in chat. I literally had a friend of mine who's an early interventionist use this phrase. She said, with tele-intervention, I've had to stretch my coaching muscles. So I know several of you have said that here in chat, but I want to see how this checks in with lots of you. So you'll have to open your participant box if you didn't already have it open. Look toward, after the list, you'll see a raise hand button. So raise your hand if this speaks to you, that you've had to stretch over the last couple of months. Boy, Caitlin's hand went up fast. Yep. Who else? Other folks had to kind of stretch your coaching muscles, kind of stretched your practices through tele-intervention. If you can't find the raise hand button, you can type yes or give me a thumbs up in chat. That's the other way to do it too. So lots of folks felt stretched. So you're not alone with that, right? Some of the things that I've heard folks say with stretching their muscles is really having to practice the hands-on support because your hands are not there with the family, right? Practicing observation, which we're going to talk about, really digging into that. We're going to talk about that next. We already mentioned the modeling less. Some folks are still modeling. I know some of our motor therapists are using a doll or a teddy bear to try to model hand placement, things like that, and that's totally okay. Really paying more attention, facilitating, observing more parent-child interaction, using that descriptive language, kind of being more intentional about how you describe what you see, and thinking through next steps, doing things like instead of just talking about the joint plan, now emailing it or texting it to the family afterwards. So we're kind of using technology to make those connections in different ways. What are some other things that come up to you for coaching stretching your coaching muscles? What is that? Those of you that raised your hands, how have they stretched over the last couple of months? Type into chat anything that maybe I missed. When you think about that stretch for you, what's that felt like? What's that looked like? Oh, Vicki says she's done video analysis. Vicki, is that analysis of your own session that you recorded the session, or families sent you videos? Because I've heard both. Folks are recording sessions and reflecting there. Vicki says, no, the parents send lots of videos. So as long as everything's in place for that to happen, I'm sure you've got that in place, Vicki, with confidentiality and all those protections. And now analyzing videos with families is a fantastic strategy. And sometimes you can see things like that authentic observation, like I mentioned. Let's see, folks are saying there may be placing things in the environment so parents can see what I'm doing. Yes, so using that environment. Jen said it's kind of made her more aware of what she's doing well and made more use of parent interaction. I love it. Caitlin says it feels like sitting on her hands because she's got to teach parents in a different way. Yeah, I love that. Through her words rather than showing and telling. Yeah, I think in Tele-Intervention, your voice is your power, right? Your voice and your eyeballs, your ability to observe and use your voice to help walk families through it. And Kara says, increasing comfort with pauses. Yeah, your article says something like, interventionists need to embrace silence and be okay with it. And that is hard to do. But Carrie says, yeah, the pauses. Kim says doing less. So asking the caregivers more reflective questions using that video review for problem solving. Yeah, I love that idea. With the video review, are you guys having families text the video clips to you, or are they emailing them, or both? I'm curious how those videos are exchanged. Just let me know in chat. And Joanne said spending maybe more time explaining the rationale behind items on the ASQ when she's doing her eligibility screening. So you know what, Joanne, with that, you're doing even more education of the parents. So that's powerful. Vicki said she's getting those video clips both mostly through text, but through email too. Awesome. And Andrea says usually through text. Kim says text or email. Some parents have a YouTube or Google link and they'll share that. That's very cool too. Using that technology in all kinds of ways. I love it. So with that in mind, with stretching your coaching muscles, and I'm even in line with the videos we're talking about, I'm hearing folks saying that it's helping me become a better observer. So when you think about that, what I'm hearing folks saying is that they are spending more time observing the parent-child interaction, where before we maybe would spend a little more time observing the child. Or there was actually more time with the parent observing me than I was me observing the family. So that shift has made them be a better observer looking at the environment. What are some other strategies you're using with observation to help you learn about the families? Maybe how are you observing the environment and helping the family take advantage of what's in the environment? How have you become a better observer? Type it into chat for me. I'm also curious about how you prepare families for being observed, because being observed on the other end of a camera can be kind of uncomfortable for families. So what resources, what are you doing to help families get more comfortable with being observed? We're we're used to being observed, but families might not be. So Carrie says she kind of lets them know, I would like to observe and I know it might be weird. So you're trying to kind of help them, give them permission for feeling a little uncomfortable with this, and it gets easier. Yeah, thanks, Carrie. Carrie says she turns her video feed off. That's an interesting thought, Carrie. So the parents aren't seeing you with your face in the camera watching them. That probably takes a little bit, some of the discomfort, because then being observed is a little less obvious. Pam, you're using one of my favorite strategies. Can you show me what that looks like? Jen says, yep, observing from a blank screen to prevent the child from being distracted. So Jen, what a great idea. So you could be having the family you're turning your camera off. Another strategy I heard a therapist say is the mother was trying to turn the camera toward the child during a feeding therapy. And the therapist said, I actually need to see you. So she had her turn the phone away from the child and prevented the child from being distracted by looking at the phone. Really, she wanted to observe the parent instead of the child. So it was really cool, where something, that she hadn't necessarily had to say before. So Joanne says she often starts with a phone call to explain what she hopes to observe, and then they move to a video chat. So you're laying that groundwork, Joanne, great. When the parent puts the computer in front of the child they're eating, it adds different dynamics to things. Absolutely, Jerry, so that can be a challenge. I'll tell you guys another strategy I heard, because I'm curious about any coaching you give parents to help them know how to position the device so you have the best view. I heard through someone else this really cool, simple strategy the other day. If a family's using a phone as their primary device for interacting with you, have them put it in a tennis shoe. And so then they have an automatic stand. They can carry that shoe around and tilt the phone, move it around however they need to. But, most of us have some kind of shoe, so we can put the phone in there and you automatically don't have to worry about the phone falling over. Super cool idea. What other strategies have you told families to help them know how to use that, how to put the device where you can have the best view? Any other ideas? Good, Kim, I'm glad. I loved that idea. I thought the shoe idea was really cool, because most people don't have a tripod, right? So we're trying to make it work. All right, well, I'm going to keep us moving. If you, oh, we got some here. Jen says, prop it on the back of a water bottle or a sippy cup. Yep. Katie says, coffee mugs are nice and sturdy. That's a cool idea. I know some folks are trying to encourage families, if they have the option, to use another device, because a phone is pretty distracting, because a lot of toddlers are given phones to keep them entertained. So if they have another device, I've also heard of somebody using both parents' phones for a visit. So the service provider actually had 2 different views during the visit. And I thought that was super cool. So that's another way to do it. Yeah, Jennifer says one parent streams their computer to the TV, but that's over the mantle. That's a cool idea. Put the laptop or the iPad up on the shelf for a bird's eye view. Yes, you can see the whole room, Joanna, Mary Kate, great. So some of these kind of views might give you access to seeing activities you missed before, things you didn't have access to. What are some activities that you've maybe joined through Tele-Intervention that you hadn't done before, or something unique? Morgan said she observed a family using their baby gate. I know we already heard from Jen about went to Walmart. Somebody observed a safari park. I love that. What else have you observed? What other kinds of activities or routines have you observed now? Maybe that could have gave you a different view than you got before. Because like I said, as you guys are typing them in, I'm hearing folks saying to parents, take me along. You do have to deal with the vertigo of being moved, but take me along with you. If you've got to change the child's diaper, take me along. Put me in the shoe and take me along. So what other routines? Because folks are saying sometimes they're having a little more flexibility. Instead of that visit every Monday at 10 o'clock, now they can go on Tuesday at 3, or they can see some other routines, which is very cool. Mary Kay says, crazy fun, roading up and down a hallway with trucks. I love that. That's so awesome. Caitlin says she observed a mom just naturally playing with her child, singing to her, making up a new dance. That's the rich stuff, Caitlin, where you can help make a difference, because that's the stuff they're doing all the time, right? Stephanie got to observe somebody at home and at grandma's. That's kind of cool. You got to see both homes. Jen saw a family take a new puppy outside, and the challenges come with something as simple as that. Yeah, Carrie says diaper changes. A session with an older sibling, that sometimes we didn't get to see that before because the kids were older siblings, might have been at school. Carrie's observed meal times. Morgan said, yep, other family members. Kiddos during outdoor play kitchen, outdoors to see a new perspective. Yeah, so one of the cool things I think when you're observing these is almost to remember to be quiet, right? And to just observe, see what happens before you, and then be that voice to say, you know what, let's try this. Let's see how this goal can fit in this activity and what strategies you can use. Seeing what's already happening helps us build on what could be there, right? You guys know that. Here's the big one I've heard people say. Doing it this way allows me to help families take the lead. Parents are taking more of the lead in their child's intervention because you aren't there as the expert, in air quotes, to do that. So what are some strategies you guys have used to help families, especially more reluctant families, to take the lead in their child's intervention? How have you helped families who are used to you being in the home transition to being in this lead role on the other end of the device? What are some strategies you've used? And if you have a good story about how this has worked really well, I would love to hear it. I'll tell you some of the strategies that I've heard. Certainly for the check-in at first, to find out, check in with families on an emotional level, like Patty said, how are they doing today? Check in emotionally before you do the other stuff, because so much crisis is happening now. If families' needs for safety and security, all the insecurity we're going through in the pandemic right now, it can be really hard to take in new information about a child's intervention if we haven't taken the time to see how families are. There are lots of strategies about preparing families ahead of time, doing that pre-visit tech check, but doing a visit, even a phone call to say, this is what this could look like. Brainstorming activities that the parent and child like to do together, or activities that are hard, and planning ahead for what you'd like to see, especially when you're establishing new relationships with families. Another great strategy is processing what you're seeing the parent do out loud. Help build that parent's awareness of what he or she is doing in that moment. So use your descriptive language. And doing some of that really specific, providing feedback, giving really specific opportunities to reflect and problem solve together. Know that in a tele-intervention visit, often you have a lot of conversation, and that's okay. So let me see what you guys have plopped into chat. Let's see, Mary Kay says, I observe first and I say something like, I love the way you, to validate that parent. That's so important because observation can feel like you're being judged, right? Jerry says, yeah, that's the reason why telehealth has worked so well. She gives lots of encouragement and praise. And a lot of times families don't get that. Can be a very positive point in their week, right? Yep, providing positive feedback, reinforcing what they're doing well. Caitlin, this is a great one for folks to write down. Start your visit with how can I be most helpful to you today to match what they need in the moment. So these are fantastic strategies. And I think some of them could be helpful to think about, especially when things get hard. Taking that deep breath, revisiting what you already know, and thinking about how you can tweak that when it's hard, because sometimes it is. So before you answer the question on the screen, how do you think this interventionist on screen is feeling? Type it into chat for me. What feelings come up for you when you look at her? And I'm going to say, I hope she has turned her webcam off on the family's home visit before she looks like this, right? We don't want families to see us looking like this so much. What is she? Vicky says overwhelmed. Jennifer says defeated. We have overwhelmed. Jen says that might be when the kids have grabbed the phone and taken you for a walk. Yet we have fatigued, frustrated, discouraged. Maybe Millie says struggling because the parent engagement is a struggle. Lots of distractions, frustrated, tired. Yeah. And these are all very real and okay feelings. You guys are growing without often a lot of preparation to do tele-intervention. You had to shift gears and shift what you know to a new situation. And all of us are going to have times, yep, Jen, when we're mentally tired, when a visit doesn't go the way we were hoping, and you feel this way, right? So type into chat for me, tele-intervention is hard when. Go ahead and finish that phrase. Joanna's got us started with when the family has a hard time with technology making that video chat impossible. Yeah, a friend of mine is supporting a grandmother and a toddler right now. The grandmother is not interested in any technology, so they are doing the best they can by phone. And it's hard, and the service provider is wishing she could do more, but she's doing her absolute best. And she's probably providing some emotional support too that really matters. So it's hard when there's a lot going on in the home. When you have back-to-back visits and you get a headache from staring at the screen. That's a reality, Jerry. When technology doesn't cooperate, when the family's not comfortable. Yeah, when it's hard to get that engagement and there's that chaotic. You send the link, text the reminders, and then nobody clicks that link and shows up. Yeah, Mary Kay, and you make a good point. A lot of these frustrations, except for the technology, they're kind of stuff that happens in person visits, right? But now we have that additional challenge of the difference of the interactions. Yeah. Ashley says, as a leader, when you see your team experiencing burnout and you're not together, so it's hard to help them and hard to support them. Yeah, especially when we're used to going to visits. You're right, Ashley, you bring up a good point. I think early interventionists can kind of feel isolated as it is, going from visit to visit, but now not getting to see each other for support, that support has to be really intentional, right? It has to be different. We have to reach out in different ways because it doesn't happen in the hallways like we're used to. When you're feeling like you didn't connect with the parent or you lost them, or maybe coaching isn't working so well for families and they say, when can we just do this back at my house? Yeah, Tanelia says you have to sit and stare at screens longer than for an hour. Yeah. Missing people in the 3D. Yeah, missing some environmental cues. We're missing a lot, right? So let's think about what some strategies you guys are using, and the top 3 things that I'm hearing from folks about intervention is hard. The first one is definitely come up in chat. All these I actually think have. When caregiver engagement is a struggle. So I want to challenge you with your perspective here. Oftentimes when we talk about caregiver engagement as a struggle, it's easy to say when the parent won't stay with me, or the parent puts a toddler in front of the phone and leaves, or when the parent's not paying attention, or when we're face to face when the parent is on her phone. I want to challenge you to flip the switch on that. And instead of placing the onus on the parent, which sometimes, we definitely feel like that's the struggle, what can you do differently to help that parent engage? How can you prepare them ahead of time? How can you find out what's going on in their environment that is causing them to be so distracted? Especially now when more people are at home, kids are at home that maybe weren't typically there, maybe they are in the summer, but maybe not. What can we do to support this? And you guys have put lots of good strategies in the chat to support this engagement. One of the best strategies I hear folks talk about is what you guys talked about earlier about setting the stage before the visit. But remember, you've got to repeat that. You set the stage, you let them know how this works, check in on technology. Here's the IFSP outcomes. But maybe do that more than once. Check in with them frequently about how they feel tele-intervention is going. Plan ahead of time with families for what activities they'd like for you to be a part of. Eventually, it might be you just open the Zoom, Microsoft Teams up, whatever, and the family says, today this is what I want to do. But in the beginning, be as intentional as you can to at least give a little room, for something purposely planned, and then you can flow with the following the family's leads later. Another strategy I've heard folks say is sometimes they're doing shorter visits. That, starting with a 15-minute visit to help the family acclimate to this new way of intervention, and then growing the time over time as the family feels comfortable. Now that you have more flexibility, try different times of day than you did before. Try to observe other activities and interactions. Find out how life is continuing to change for that family and adjust, which is hard. Another thing I want to encourage you to do is when you're feeling this struggle is to take that deep breath, give yourself a little grace, give the family a little bit too, because they're going through a lot just like you are. And sometimes it is just hard. But one of the best things I think you can do, and Ashley touched on it, is go to your team for support. Reach out to them, call somebody, set up a Zoom meeting and talk with your colleague or your supervisor. Invite somebody to observe your visit with family's permission. Have them join that meeting, but maybe not turn their camera on so they can watch, and then you can process it with them afterwards for some ideas. Or do the same, observe someone else's visit virtually to get some ideas. Don't forget the supports that you do have out there, even though you're not in the office together. Another struggle that I've heard folks say is the struggle of working from home. So tell me in chat, how's that gone for you over the last 6 months with trying to juggle doing your job from home, but also doing all the other stuff you would normally do at home? How's that going for you? And what are some strategies you've used to set some of those boundaries at home to make it work well? Type them into chat for me. Awesome, you guys are putting things in here. Yep, have the parents take video of the child and send it to you. Yeah, tried out after hours Zoom meetings for our staff when we just talk and play games. What a great idea, Ashley. Jen says she starts the session off with checking in about the overall family's health. What new things did you do in the past weeks that you'd like to share? What's been difficult and how do we move forward? Andrea says working from home, lots of multitasking. Tanelia says, I want to be at my office. Not the same. Yeah, it's hard. Finding the scene between working and not working, Kara, boy, that's always my struggle. Where's that line? It's a hard one when everything's right there with you, right? Well, here's a couple strategies I want to give you guys for working from home. Set boundaries, which is very hard. If you can set boundaries with your family, that is a great idea. If you have a way to have an area that's dedicated to you, if you have visual cues for your families when you're on a visit and you can't be interrupted. I used to wear my lanyard when I was working from home. Well, I've worked from home for 10 years, but wearing my lanyard to give the visual cue that I am on the clock. If you can schedule breaks for yourself, especially if you have children in the home, schedule breaks. Don't do those back-to-back visits. Schedule breaks so that you can go fill the cups up of your children. And I don't mean their sippy cups, I mean their emotional cups, so that they're okay for you to be on that next visit for that 45 minutes. I want you to fill your own cup up too. Take care of yourself by getting schedule breaks to get up, to move around, and to hydrate. And here's a tip my eye doctor gave me to avoid those headaches. Well, I'll say to try to. He said, eye strain is caused by focusing up close. The headaches at the end of the day are also most often caused by hydration. So have that giant thing of water near you, whatever you like, tea, and make sure you're hydrating. No family's going to mind it if they see you drinking on the other end. Well, as long as it's drinking water, something like that on the other end of the video, right? But I want to encourage you to do what my eye doctor said. Every 20 minutes or so, even if you're on camera, you can kind of do this, or at least at the end. Focus your eyeballs on something far away. Focus your eyeballs there for 45 seconds. It rests your eye muscles and will help relieve some of that strain from staring at the computer right in front of you. If you're on a laptop and your head is tilted down, that's not good for your eyes or your neck either. So if you have the ability to have your screen up in front of you, it's another way to help you with that strain. Let's see what you guys have put in here. Oh yeah, Jen says I'm at home. Yeah, mom, husband who's also working, so there's lots of noise. The dog barks. Yes, Jen. Let the family, Mary Kay says, let them know if they need to stop and attend to another child's homework needs, that's okay. Toby says, it's hard to figure out where the end of the day is. Yeah, keeping your home and office space separate. Figuring out how to get your teenagers to stop interrupting. Boy, Jerry, if you figure that one out, let me know. My 16-year-old will open my door behind me and whisper as loud as he can because he still thinks that nobody can hear that. But if your teenagers can text you instead of interrupting you, that's my go-to right now. I tell him to text me. But don't text me anything too important, you know, unless he's bleeding out of the eyeballs, he needs to handle it himself. But I hear you, having teenagers is hard, you know, you're having little ones too when you're going through all of this. Joanne says, nice compromise. Service coordinators go to the office 1 day a week, so they're still getting some of that office time. Tanelia says she takes a short brain break for 5 to 10 minutes. Such a good idea, Tanelia. Get up, move around, give that brain a break. Yep. Trying to find quiet time. Putting laundry in the washer, get up and move around. You know, Jen, just simple household stuff, the have-to-dos at home can help you get that break too. Yep, I totally think that. There's some great strategies, you guys. Last one here is technology, and we've kind of talked about that when technology doesn't work so well. And I think you guys have kind of talked about some good strategies you're using, like having that phone call with the family before you have the video chat. If you have a resource you send to families, talk about it in the chat. If you know, some folks are preparing like a PDF handout, they're giving families with some tips for technology. We have other strategies popping up for taking care of yourselves. Exercise every day. Yeah, leave the house, Sarah, so important. Me too. 15-minute workouts midday have saved Toby's mental health. There's so many good apps for that, Toby. 10-minute yoga practice in the middle of the day is such a great thing to do. Whatever exercise helps you, do it. Go outside, get some vitamin D. Yep. So technology, you guys, the key technology tips, and you guys probably already know them. When in doubt, log out, right? So if something on the family side isn't working, something on your side isn't working, have that backup plan that you can text the family, call them, log out, log back in, let the family know ahead of time. If the screen freezes, we get bumped out, take a deep breath and try to log back in. Always have that backup plan. And the worst case scenario is it doesn't work. Again, give yourself and the family some grace, reschedule, and try it again later. The technology is hard, but people are finding some pretty cool workarounds. So guys, as we start to wrap up, I want to ask you another big question. When you think about over the past 6 months, how have you grown? So you've got all these great strategies you've come up with. Some of you, I know Janet said she's getting a little better with the computer. Folks are becoming more patient. Take a minute and pause and think about yourself as a professional. How have you grown as a result of providing tele-intervention or being part of this virtual early intervention world? Talk about it in chat. Oh, Mary Kay gives you guys a great technology tip. When their audio doesn't work well, go back to the phone. You can always use the computer for video and the phone for audio. Great strategy. So Kim said she's been able to do more review of evidence-based literature. Yeah, Kim, without all that travel time, sometimes people are able to peek into things and learn a little bit more than maybe they had time to do before. You don't have to just read articles in the 7-Eleven parking lot between visits, right? Amanda said she's been forced to learn more about technology. Sometimes that doesn't feel so good, right, Amanda, being forced, but you can come out really stronger in the end. What else? What are some other ways? You know, this is right, exclamation point. Oh, wow. Ashley says a decrease in her anxiety for some reason, which has been nice. That's a great thing. Yeah, Ashley, my anxiety was going through the roof at the beginning of the pandemic, but as I've settled in, and even settled in with more time at home with my family, I found that I'm feeling more centered, which is a very cool outcome of all of this experience. Jen has more time to reflect on her practices, and reflection is how we grow, right? Tanelia says, learning new ways to use technology, new apps. Forced to learn more technology, less paper copies, doing more online, better for the environment, right, Joanne? Good, increased your technology. Sometimes, you know, sometimes when you do something and it was hard, you're gonna find that everything is hard, right? You kind of forced into some things, forced into tele-intervention, but everything's hard before it gets easy. So give yourself time. Jerry's tapping into her creativity. Mary Kay, she'd gotten into the habit of emailing strategies we talked about, and they respond back before the next session. So that kind of between session communication, Mary Kay, sounds pretty cool. That's a great way to support families with that kind of back and forth. So we think about the future. You guys have come a long way these 6 months. So let me ask you next, let's think forward for a moment. How do you think you're going to maintain what you've learned when we transition back to in-person visits? What are you going to take from what you've told me today and carry through with you when you start seeing families face-to-face? So think about that. What will you take forward from this experience and use when you're sitting there and you're getting to be 3D with families again? What are you going to carry forward? What are you going to keep doing when we're back to some kind of new normal? That's a hard question, right? It really requires us to think about it. Oh, Jenny says she wants to continue to offer this option of virtual visits as long as insurance pays. Yeah, I've heard some families are really finding that this works well for them. Kim's going to carry her improved coaching practices. Amanda says continuing to learn and more about technology, even when she's back to seeing families face to face. Vicki, I love it. Going to keep hands off and keep coaching, giving that space for more reflection. Tamala wants to use technology between visits. Jen says making sure we're addressing that previous joint plan every time and what did or didn't work. That's so important, Jen. The joint plan is not a how did it go? Oh, it went well. It's digging into what went well. Joanne says, I'm hoping to maintain my parent coaching game. I love it. Mary Kay wants to keep improving her observation skills. Look and listen first before offering strategies. You nailed it there. That's great. Hearing to more coaching. Oh, Mary, that's a very honest appraisal. More than I did when with my reliance on interaction with the child. Good. More flexible scheduling practices. Try to help parents be more hands-on. Keep sitting on my hands. Yep, Tara, that's great. Continue to learn. More observation time. Be more receptive to the family. Rhonda says, not just the child. This is exciting. One thing I want you to do, I want to tell you about another resource that just came out today to help you keep thinking about where you've been and where you're going. Ann Brager in our Partsy office wrote this fantastic article on the rituals we've developed in going through this whole process of living through the pandemic and providing early intervention there. It's in our September Partsy update, which came out today. It was in your email, and it looks like it's in a new format, which looks awesome. It's part of her Leading from the Middle series. So even if you're not in a leadership position, I really encourage you to read those articles. This ritual article is a fantastic resource, so check it out. It'll help you keep thinking. I want to also offer those of you that are in a leadership role some more information to help you keep this conversation going. So today shouldn't be a one and done, like keep talking about it. So on our website, we have developed 3 new learning bites, but they're actually learning bites with learning bites within them. So when you go to our learning bite page, you go to the VEIPD.org page, look on the banner at the top, click on topics and tools, and then in the drop-down menu, you'll find learning bites. At the top of the page will be links to our newest learning bites on Tele-Intervention. So those of you that are in a leadership role or just like to lead some training or some staff development with your colleagues, all of these are designed to be done online. They can also be done in person, but there's guidance, the orientation to Tele-Intervention if you have folks that are joining your team that are new. 3 sessions, so you could have 3 video meetings, and there's guidance in there about activities and videos you can use to dive into that. If you want to keep the conversation going about using Tele-Intervention to conduct your visits, there's a 2-session plan that takes advantage of some really cool videos that have recently, well, over the last couple of months, been posted by the Early Childhood Technical Assistance Center that shows Tele-Intervention, and you get to hear from families. That site has also recently posted 5 or 6 new little short video clips of families talking about their experience in Tele-Intervention. If you have any trouble finding them, just email me after today and I'll help you find them. I haven't even looked at the site, I just heard about them. But they're great for, you could send them to new families so they know they can hear from other families about what to expect. And then we have We have a learning bite on conducting tele-assessments that you can do with your staff over 3 different meeting sessions to explore tele-assessments. So really good resources there. I hope you'll take advantage of these to get your staff together for some support across, across time beyond today. So with that said, I want you to take that deep breath again. I know after this, you're probably going back to visits or back to helping kids with homework or going back to real life. But don't forget to take care of yourself, because what you do, what is there that saying, how you do, how you are is as important as what you do. So take care of yourself while you're taking care of families too. And I hope that someday this is where we're going to be. We're going to be back in the right side up world. We'll be looking in that sphere, remembering where we've been, taking that deep breath and going, gosh, we lived through that. How resilient we are, what we've learned, and how is this going to help you be an even better interventionist than you were 6 months ago. So wherever we are 6 months from now, even if we still feel a little upside down and topsy-turvy, I hope you have moments that feel like this guy. You might feel upside down, but sometimes it's kind of awesome. So I would love for you to use my email. You see it here. Feel free to email me with ideas if you need resources, you have questions, or if there's something you still need related to tele-intervention, let me know and I'll share it with the professional development team, because we're here to help you. Jen has posted a link in chat about some breathing exercises. Thanks, Jen. I love that kind of thing. And know that we're here for you guys. We want to support you and keep you healthy, because all the work you're doing with families. Give yourselves a pat on the back, because it's hard work, but it so matters. And you've risen to the occasion these last 6 months. So I would love to get feedback on today's session. You're going to get a survey after we wrap up that gives you an email that gives you a survey link. Complete the survey. You'll get a certificate for an hour of professional development. And we really hope that you will join us for our next 2-part Talks on Tuesday series in September and October, which is to help you learn about the ACEs. So ACEs stands for Adverse Childhood Experiences, what those are and how to support children and families who are experiencing ACEs. So Amanda, I'm so glad you enjoyed the presentation. Yep, Corey, Patty, it was a beach, and maybe Corey, it was just for you. I love that beach look, right? So Kara, you're so welcome for the support. I hope you guys have enjoyed this time, all the research. Yep, Stephanie, you're very welcome. Reach out to us if you need us, and have a wonderful rest of your day. Take care, everybody. Bye.